My name's Charlotte Emma. I work in a team for the community where we're responsible for the placement of pre- and post-registration students in nursing and allied health professionals. CPFT is the organisation, but that's what we're known as. And I was going to say something about the size of our organisation, but as we've heard from you in Scotland, really getting to the Shetlands is a little bit different than getting to Wisbech, which is our area of difficulty. Our trust covers an area of about 60 miles from north to south and 55 west to east. And we serve a population of about 100,000 people, and our organisation has about 3,400 staff. So I was going to say about the challenges we face in terms of it being a community trust, which they still stand, but not on the same scale that you've explained about earlier. And I work for the community, and Rachael works for Addenbrookes, which is a large acute trust. And the community trust wanted to be involved in this because it's usually something that we get involved in towards the end, because it's piloted in the acute trust first and then rolled out into the community, and we were very keen to be at the forefront of this on this occasion, so that's why we're involved.
My name's Rachael May. I'm Senior Nurse for Pre-Reg Education at Addenbrookes Hospital, which is just down the road. We have approximately about 350 to 400 students in nursing and midwifery across adult paediatric areas. We have about 3,000 registered nurses. On our mentor register, we have about 833 at present. So quite a large organisation, quite a large organisation to cover in terms of, it's about 4 miles across the entire site. So lots of different clinical areas, lots of different specialties. Charlotte and myself, we work quite closely together, and we work in partnership with the university. As an organisation in 2014, we went completely paperless. So all of our documentation is electronic. So we were already in that frame of mind. So when we had the opportunity to trial this, we were quite excited because we kind of want to get rid of all of our paper because we don't use it anymore. So we were quite excited to be involved. And again, also to work in partnership with our community partners. And, you know, we both like to think as organisations, we're very forward thinking, we're very innovative.
So just to give you a little idea about the size of the cohort that we started with, we started in February 2016, and there were 126 students in the cohort. They were second year students, and they were almost divided in half between Addenbrookes and ourselves. In the community we had 41 adult branch and 26 mental health working in the community setting, and all the other students were in the variety of settings that you've heard about in Addenbrookes. The students all received extensive training in the university before they came out to us, and we were offered, in liaison with Sian and the team, for all the mentors to be trained. And as you can imagine, that was sometimes easier said than done, because as you've seen today, mentors can't get to places sometimes, even with the best intentions, because the clinical workload restricts that sometimes. But it was there on offer should the mentors be able to access it.
And I think that one thing I would say, what was pivotal to the success of this was the students being prepared in the university first. So they came out into placement ready to use the tablets. And without that, I don't think it would have been as successful. So in terms of feedback from mentors, one of the things that both organisations did, we looked at our internal comms. So we wanted to advertise, we wanted to put the messages out that this was coming, you were going to be using it. We invited mentors to informal training sessions, so we would turn up in ward areas where we knew the students were going to be going to and using the tablets, and we also did formal drop-in sessions as well. The formal drop-in sessions don't always work, and we know that historically. We also know that from when we did our EPIC training as well, thinking about how we can best meet our mentors in practice without taking them away from their clinical priorities. And that did make that challenging sometimes, because obviously when areas are short, we can't sit and train staff. I know we sometimes did one-to-ones with mentors as well to try and ensure that they had the support and the training. But we had good engagement from our mentors. They were wanting to learn. A lot of our mentors, again, because we were already using a lot of our digital literacy skills, they were very quick to pick up on how to use the tablets. We used a lot of team meetings. We have monthly mentor updates. And Erasmo came to a lot of those mentor updates for us to do some of the training as well. So again, we had good support from the university in training our mentors. Now, interestingly, there is a fear of IT for some people, and even within Addenbrookes, even though we're paperless, there are still some of our staff that don't particularly like technology, and it is about recognising those staff who need additional support, because there will be some staff that struggle with IT and using it and getting to grips with it. So it is important that we scope out those individuals so we can support them, because that does make it challenging if it doesn't work. Lack of IT resource for us wasn't an issue because we were paperless. We've got tablets, we've got computers, we've got wireless computers, and because of that, what we found is that a lot of our mentors actually chose to use the computer rather than use the tablets. But we've got the resource to do that, so that made it really easy for us. But I think the community, a different story.
Yeah, we are currently in a process of going into hubs, and our staff there's about 30% actual sitting down at a desk for the actual staff. So there's a significant issue for us in terms of accessing computers, which is obviously something that you've found as well in placement, and the staff find it just as frustrating. So actually the tablets were a bonus for us because it meant that you could actually go and just find a quiet space somewhere and complete the assessments without having to sit in front of a desk.
I think the other thing that we did as well was we made sure that all of our mentors had links to the web pages with the university, so that if staff wanted to look at the videos, they could do, so that they had that additional support as well.
So the things that the mentors reported back to us as being areas of concern or frustration for them were, and many of these issues have now been resolved because of the communications that our staff have had with Sian and the team. Things like moving back and forth between assessments. The staff would put something in an assessment and then they would want to go back to it, and it would then appear to have disappeared. And so we'd be getting frantic phone calls about, I've just spent all this time doing this assessment and now it's gone. And actually that wasn't the case. It had been stored, but they couldn't find it. So there was quite a lot of IT support, I think, in terms of that wasn't there for mentors who hadn't got that level of confidence as to where the information had gone. There were some problems in terms of logging in during practice hours, but really they were quite minimal. But on the whole, our mentors preferred the electronic assessment. They liked not having raggedy bits of paper to write on. They liked the fact that the student had the tablet with them all the time. Often students would not bring their paper documents in because they do get so dog-eared, so they would just bring them in when they needed to, whereas this is a much more interactive way of working. The mentors reported they found them easy to use, they were interesting to use, and the thing that highlighted the most, but obviously was for a very small number of mentors, is they found the cause for concern process is because it's a rapid communication in real time. They found that much better because there wasn't that delay between filling the paper document in, the student submitting the document, the feedback from the tutor, and then that in reverse. So that was a huge bonus as far as the communications were concerned, and it meant that the tutors and our mentors could support the students who might be struggling for whatever reason much more rapidly.
And I think one of the other things that we're picking up on, so we've had a student recently who's got a paper document who's lost one of their first year placement books, and they're in their final management placement. And actually, how do you then go back? If it's stored electronically, we've got the ability to access that and see that. So that's going to make things easier going into the future. So what has it meant for us?
Please do that.
So greater collaboration between our organisations, and I think that's community and also the university. What's great for us, Sian very kindly set up our access so that as educators we've got an overview of all of our students on the Addenbrookes site. And what's been helpful is if there's been an issue with a student, we're able to look at the student's assessments before we go up to that clinical area with some information. So we've got a bit of background, so we're able to engage with the mentor and the student in a much better way, providing much better support. And again, the communication partnership working with ARU, Sian has been fantastic in terms of if we've had issues, Erasmo, we certainly have felt the support there, and that partnership needs to be working really well for this system to work. It's highlighted where we need to put further support in for clinical teams, and again that's looking at assessment processes, mentors, how they're feeling and what they need as well. So that's been quite interesting. And it's been good to be able to read all of the assessments as well for cohorts to look at where we need to improve in terms of moderation in practice, and that again has been really helpful. Highlighted overdue assessments, we can go in, we can get an overview, and then we can go to those areas, we can remind, we can help provide time for mentors then to do those assessments with those students. And again, like I said, having an overview of the students' assessments, it means that we can troubleshoot, and it creates greater transparency, I think, for the students as well. And the accessibility to previous assessment helps the mentors in terms of progression for the student and how they're developing and how they're learning, and that's been really important.
Just one thing I've just realised I forgot to mention. We actually trained some of our senior administrative staff to be super users in the use of the tablets, so that the students didn't need to keep going back to SHA. And the idea was that we would have people in our own organisation who they could go back to should they want to, because sometimes it's easier to go back to somebody in your own organisation than it is. This was for the mentors, I should have said, sorry. It's sometimes easier to go back to somebody that you're familiar with, who can just help you out with something that's possibly quite straightforward to do, but maybe a little bit embarrassing to ask an external agency. So I think we set that up, and you did also, didn't you?
Yeah.
That was very well used by our mentors.
Okay.
Great, thank you very much.